Hey everyone, this is Krish. In this video, we'll be talking about an introduction to first impressions. Much of what you need to know about any individual patient can be obtained by watching them enter the surgery and sit in the chair, their body language during the interview, and a few well-chosen questions. Chapter 18. One of the great secrets of healthcare is to develop the ability to actually listen to what your patients tell you and to use that information. Doctors and dentists are often concerned that if they allow patients to speak rather than answer questions, history-taking will prove inefficient and prolonged. In fact, most patients will give the information necessary to make a provisional diagnosis and further useful personal information if allowed to speak uninterrupted. Most will lapse into silence after 2-3 minutes of monologue. History-taking should be conducted with the patient sitting comfortably. This rarely equates with supine. In order to produce an all-around history, it is, however, customary and frequently necessary to resort to directed questioning. Here are a few hints. Always introduce yourself to the patient and any accompanying person and explain what your role is in helping them. It is useful to clarify at this stage the relationship of any chaperones with the patient, a relative, friend, or support worker. Remember that patients are usually neither medically nor dentally trained, so use plain speech without speaking down to them. Questions are a key part of history-taking, and the manner in which they are asked can lead to a quick diagnosis and a trusting patient or abject confusion with a potential litigant. Open questions should be used that require more than a simple yes or no answer to avoid leading the patient. Be careful of this when the question suggests the answer, is the pain worse when you drink hot drinks? However, with the more reticent patient, it may be necessary to ask leading questions to elicit relevant information. Notwithstanding earlier paragraphs, he will sometimes find it necessary to interrupt patients in full flight during a detailed monologue on their grandmother's stick parrot. Try to do this tactfully. That is a lot of information you are telling me. Can we recap how this affects the problem you have come about today? Specifics of medical or dental history are described in percent the dental history, P4. Percent the medical history, P6. The object is to elicit sufficient information to make a provisional diagnosis to the patient, while establishing a mutual rapport, thus facilitating further investigations and treatment.